Like most of us, I was told to study hard to have a successful life. That if you're good in English, math, and science, you'll have lots of money and be happy. And so I followed that advice. Study hard. So now I'm a doctor and a teacher in a university hospital. My clinical practice has started to pick up. My work in my advocacy is rolling, and as a bonus, my social media accounts, the Skin Sensei in Facebook and Twitter, have gained quite a following. I can say I'm in a sweet spot in my life right now because I studied hard. But no, that is just half the story. A big reason why I'm here today is because of something that not one teacher has taught me. Something that I accidentally asked myself when I was 21 years old. What do you love? It was in 1987 when my fondness for Miss Universe started, when I saw the crowning of Miss Chile, Cecilia Boloco. At that crowning moment, I knew I had eyes for beauty and that I was different from other boys. I like other boys. That somehow petrified me because I didn't want to be expelled from an all-boys school. I didn't want to lose my parents' love. I tried to cover that flaw with high grades. Study hard and make sure nobody sees you when you lip sync to Whitney, Regine, and Mariah. That has been my narrative until college. I was good at school, but inside I was miserable, always crying at night. Then by some stroke of perceived luck, a pretty girl who happened to be a good friend professed her love for me. Oh, yes! This girl would be the answer to all my misery. However, it was also during this time when I met a young, handsome stockbroker from Makati. He was so sweet and eloquent. I felt alive and real when I was with him. But how about the pretty girl? She would make my life normal. I was so confused. And to add to the confusion, the girl proposed marriage to me. Ganda ko. In the solitude of my room, I suddenly blurted out, "What do you love?" Answer it plain and simple. Well, I love being with a man. And so on that day, I came out to myself and declined the marriage proposal. At age 21, I accepted myself as a gay man and things became a little bit bearable. So that was 2001, the year of coming out, and the year of entering med school at the University of the Philippines College of Medicine. It was so easy for me to forget that question, what do you love? Because there was hardly any time to reflect. As I was awake for 36 hours every 3 days, all I could think of was, I need to survive. And survive I did with the help of the laughter of classmates. Survive I did with the magic of Direk. Direk, short for director, was twice my age. He wasn't my physical type, but he was brilliant and talented beyond words. I found that sexy. I was also inspired by his grit. He started out as a messenger for some shows until he established his own events company. I once asked him about his secret to a successful event. He said, "Always surround yourself with beauty. That will inspire you. And make sure that your crew is properly fed. There should always be 2 cups of rice." Direk's brilliance was accompanied by a hot temper, and that was the root of our fights. Once while arguing in his car, he said, "When you graduate and start traveling, you'll understand me." Understand? 1.5 years later, I broke up with Direk. I couldn't handle his temper, and at 23, I was immature. But despite this, we remained very good friends. In 2006, during my med school graduation, Direk gave me an unforgettable gift. This breathtaking stage with a 14-foot oblation statue, an impressive fountain, and 2 giant screens in CCTV were unexpected for that time, 2006. But he made it all come true for me. My classmates were bowled over, "Taray, ganda!" This moving gift, however, did not change the fact that I didn't know what to do after med school. Like most fresh grads, I was clueless. And so I jumped into the bandwagon that was the United States Medical Licensure Examination. Being a doctor in the US is big money. It seemed the most logical choice. So it was 2008, and it was my second attempt to land in a residency program in either internal medicine or family medicine. The night before my flight to the US, the rep and I had a conversation. He said, "You know, the next time we would talk, it would probably be years from now." There was no Viber then. "But I'm sure you'll be the best in New York. Just please don't forget me. And remember, I will always love you." Ganda ko. 4 weeks from that conversation, I received news on a gloomy winter morning about Direct's passing. "Win, we think it's HIV." "What? HIV is a myth in the Philippines. And Direct is too brilliant and kind to have HIV. It can't happen to him. Can't happen to the people I love." I came back to the Philippines April 2009, beaten and defeated. After consuming almost all my inheritance and finishing and passing all my exams, I didn't land a job in the US. I visited Direct's mother, and she confirmed that indeed Direct was HIV positive. So 2009, there was no job, there was no Direct. I was lost. Study hard. I followed that to the dot, and yet I have been rejected. And worse, I had to lose somebody along the way. It wasn't fair, and it didn't make any sense. To keep myself busy, I entered the Health Policy Development Program of the University of the Philippines School of Economics in Diliman. I was getting good at it when suddenly I felt a deep longing for patient interaction. I have more time to reflect now, and I realized I failed in the US because I was just really after the money. This non-conforming gay man did not want to be non-conforming again by not being in the US. And then I remembered that question I asked myself when I was 21 years old. What do you love? I love histology. I feel giddy looking at slides under the microscope. To my knowledge then, there were only 2 medical specialties offering a lot of histology. One was pathology. Okay, I can do that, but there's no patient interaction there. We can't talk to the dead. So, how about something that you really love, Winlove? Dermatology. Oh yes, baby, I can do that. But Win, maybe you should be a pathologist because nobody takes a dermatologist seriously. Oh, shut up. Just answer the question. Me talking to myself. What do you love? I applied at the Philippine General Hospital and was very lucky to be accepted as a resident in the section of dermatology. Dermatology is a highly competitive field, and in the Philippines, it is run by women, not just ordinary women, beautiful and very intelligent women. At the start of residency, I already knew I had to differentiate myself from my beautiful and brilliant colleagues who would probably be the preferred beauty doctors of women, because women support women. So I told myself, maybe you should ask that question again. What do you love? Although I have eyes for beauty and doing beauty procedures is natural to me, I love being a medical detective. But girl, how can you be a medical detective in dermatology? It's such a superficial field. Yeah. There's a widespread misconception that dermatology is only about beauty. That is just one side of the coin. There is a side to dermatology that can be used for hardcore medicine and public health. The skin is not just an organ for sensation and protection. The skin, unknown to most, is a window to the internal organs. Just by looking, I can say that this female probably has more male hormones than is required of her. This is acne vulgaris. But combine it with a hairy upper lip, it can signal for a syndrome called polycystic ovarian syndrome, or PCOS. Females with PCOS have a greater chance of developing diabetes and difficulty conceiving. When we see this, We treat the acne but also refer to the OBGYN for further evaluation. Just by looking, I can say that this young man took a medicine prior to the eruption of this slate gray violaceous patch with some blister on his center on his left flank. This is fixed drug eruption, a manifestation of drug allergy. The lesions would reappear on the same spot whenever the culprit drug is taken. So when we see this, we ask the patient to do a drug diary so that we can narrow down the culprit drug. Just by looking, I can say that a cancer is developing in this person. This is tripe palms. Notice the velvety appearance of the palms, which resemble tripe, or tualia, the ones you eat in kare-kare and goto. It is not very common, but it is a sign of adenocarcinoma of the gastrointestinal tract. When we see this, we race against time to find the cancer focus, do abdominal imaging, and refer to the gastroenterologist. So great! I'm going to be a medical detective in dermatology. But wait, there's more. The universe wanted me to be specific. So one sleepy afternoon in the section of dermatology outpatient department clinic, I came across the chapter on the skin and HIV in our derm Bible. My life flashed before me. What? There's such a thing? So I browsed through the chapter and yes, there's such a thing. Although the HIV test is the ultimate test to tell if somebody has HIV or not, the skin, as interpreted by a well-trained dermatologist, not just anybody, can give clues as to who needs HIV testing the most. For those who already have HIV, in the absence of CD4 testing, which is very common in third world countries such as the Philippines, the skin can be a surrogate marker to determine if the patient is already in AIDS. And this can be a useful guide for other doctors to help them determine what antibiotics to start the patient on and to determine how aggressive their management should be. This is a patient who saw me for something else. I noticed the marked redness of his eyebrows. This is seborrheic dermatitis, in Filipino, balakuba. He told me that this has become harder to treat. I asked about his sexual history and he told me he's an MSM, a male having sex with another male. He hasn't had any HIV test. I offered it to him. He was a bit surprised, but agreed to it. He turned out positive. Seborrheic dermatitis can be an initial finding in HIV. I already knew what I love. That's going to be a medical detective in dermatology looking for skin signs to HIV. The next step was to study hard. So I read up on sexually transmitted infections and practiced reading the skin. However, without a thorough clinical history, the skin clues can be misinterpreted even by trained eyes. And so I also practiced asking the difficult questions which most doctors avoid. Have you been sexually active? She said no. That's okay. Is your partner female, male, or both? Do you do oral sex, vaginal sex? How about anal sex? Do you use sex toys? Do you use condoms with lubricants? What do you use for contraception? After confirming several HIV cases, I relayed my findings to my colleagues and encouraged them to be more discerning in identifying skin clues to HIV and then correlating these with the patient's sexual history. From a myth, we started diagnosing more and more HIV cases in our hospital clinic. That meant earlier diagnosis, lesser complications, less economic burden, and less stigma. After residency, I trained abroad for sexually transmitted infections. When I came back, Pia Wurtzbach, a known HIV awareness advocate, won Miss Universe. I grabbed the opportunity to write her an open letter to encourage her to talk more about HIV prevention. I was lucky enough to have my article published by a local newspaper company. Soon after that, a series of invitations for school talks and interviews followed. Felt like a superstar. But it dawned on me that on my own I could not turn the tides against HIV. An entire army of doctors is needed to help combat this veiled epidemic. And so I encourage other doctors to start relearning the science behind HIV. I started with my own medical specialty. It took me more than 2 years to convince the Philippine Dermatological Society to revisit the unique and indispensable role of the dermatologist in the field of sexually transmitted infections and HIV. Email after email, call after call, my message was the same. We need to answer to this call. Now I'm very proud to tell you that more dermatologists are studying sexually transmitted infections and becoming HIV counselors. Now more dermatologists want to understand sexual orientation, gender identity, and expression because they know we need to provide safe places for everyone. Although there is a learning curve, the good news is a new generation of dermatologists is willing to answer to this call. The period of 2006 to 2010 saw the upswing of HIV cases in the Philippines. Direk was one of those who lost his life to an AIDS-defining illness during this period. It was also during this period when I got lost and eventually found my purpose. Everything I do now relates back to this time. This time when I learned to ask myself, what do you love? It is ironic how at an early age, we Filipinos are taught on so many things all at once so that we can be globally competitive, successful in life. And yet, so little time is allotted for us to understand ourselves. Bombarding children with information about the external world without telling them how to understand themselves is like giving the best shoes to an Olympic athlete who is competing for a swimming relay. There's such a disconnect. And with social media in our fingertips, it is not difficult to picture how easy it is for our children, for us to get lost, swayed into thinking that we need to be a certain size, stature, or image to be accepted, to be loved. Understanding who we are and what we love will help us determine our life's purpose. Being an educator in social media is no easy task, especially if you focus on a controversial issue such as HIV. HIV is intimately associated with sex and drugs. That's why it's difficult to have objective conversations on it here in the Philippines, a conservative and predominantly Catholic nation. The reluctance to talk about these issues has contributed to the ballooning of HIV cases in our country. From one case every 3 days in the year 2000, we now have 32 cases per day. And the epicenters of the epidemic are in our cities. My Twitter account tries to bridge the information gap on sexual health, particularly sexually transmitted infections and HIV here in the Philippines. I get about 10 to 50 messages a day, mostly from individuals who want to know the risk of acquiring HIV after performing a certain sexual act. And there are those who message me seeking for medical attention because HIV-related services are not available to them. Doc, I'm from this island. I'm HIV positive, and there are things that are growing on my skin. I know I need to see a doctor, but I just can't. The treatment hub is 5 hours away. I need your help, Doc. Gusto ko pa pong mabuhay. It takes a few hours of my time daily to attend to the questions of these anxious and helpless individuals. Some of my colleagues would say, Win, you're wasting your time. You should be seeing actual patients and earning. But because of my experiences as a struggling young gay doctor, my love for teaching, and my love for the LGBT community, I go on. Because this is who I am, and this is what I love. What do you love? My pain finally made sense when I started asking this question during my life's critical moments. I still ask it now when I'm confused or in a rut. I can say that asking this has brought clarity to my life. Asking this question always leads me to a place of fulfillment. Self-awareness, however, is not an easy task. It is a process. The answer that we seek might not come right away. But when it comes, we need to accept it, own it, embrace it, because the answer will be different for each one of us. It will be unique to each one of us. What do you love? Accept it. I'm Dr. Winlove Mojica. I love reading the skin. And I love the Pearl of the Orient Seas, Philippines! Thank you.